Hey everybody, it's Dr. Brian McKay, Core Health and Darien, and today I want to discuss with you plantar fasciitis. Well, plantar fasciitis, unless you have it, can be kind of a boring, who cares? But it is quite a painful condition, all right? It's caused a lot of times by repetitive sprain to the ligaments in the sole of the feet, and it can be aggravated from walking and running. Sometimes they used to be the old days we call cop's feet, you know, people stand on their feet all day. Um, So basically, in some cases, it can go away on its own, which is not a bad thing. Of course, if something goes away on its own, you don't have to stress it too much. But the plantar surface is the surface that touches the ground, and this tissue down there is very sensitive. You don't have a lot of It's not a lot of meat. You always have a lot of nerves in the bottom part of your foot. So what happens? It can get like a stabbing pain. People think a heel spur. A lot of times you will have a heel spur on X-ray. But there are some really, really good, you know, good treatments for plantar fasciitis, and we'll go over those. All right, so naturally, when you have a pain in your foot, you're going to think the foot's the issue. I wanted to dispel that rumor because a lot of times people are going to have issues pretty much I would say, from the knee down. I mean, so occasionally you get some stuff, some issues with the muscles in the upper part of your leg, the hamstrings, the quadriceps. But for the most part, you're going to be from patella down, and you'd be surprised if you do have plantar fasciitis. What you do is run your fingers along the below your knee in the front, below the knee on the front, to as far out to the side as you can. It's called the peroneus longus. And a little bit further down, you have the peroneus brevis, and you also have the tibialis anterior. And I find these muscles to be involved many, many times with a case of plantar fasciitis. So you have the bottom surface of the foot, and there's a lot of tension. And the tension starts with the muscle belly, and those tendons of the muscle bellies insert onto the plantar surface. So you'd be surprised at how often you have issues with the peroneals, um, but also too is the tibialis anterior. They're big muscles and they're very important, but they also help balance out the foot. Um, your gastrocs, you know, are really also heavily involved. So if you're having foot, plantar fasciitis pain, you really just want to do yourself a check. Feel the muscles in the leg in the front, feel less muscles in the leg in the back. And I think you'd be surprised at how often these things really, really are tender. And there is a tie-in. If these are tender, there's a good chance these things are being overworked. So what you want to do is you just want to be aware of it because, everybody thinks, okay, you go get a cortisone shot. The cortisone shot will definitely take out some of the swelling, inflammation, but also too is it could just, stop you dead in your tracks with, as far as. So I guess I should go over to review the normal anatomy of the lower legs with the bones. You have the tibia and the fibula. The fibula is that small one on the outside, and that's where you're going to feel the tibialis anterior and the peroneus longus and brevis. Um, the big bone is that tibia, much bigger, but the actual fibula can really cause a lot of issues as well. Now, another thing you got to be careful for is the calcaneus. We call it subluxation when that bone goes out of place. You have the talus, you have the navicular, cuboid, and these are bones that, when they go out of place, they really affect the biomechanics of the lower extremity. And if you're going to really get to solve a plantar fasciitis issue, you'd probably be well served to do the whole, get everything checked out. It's okay, you have a localized pain and you may have a heel spur. Well, okay, is that enough to be content with that? Okay, we've got this thing solved, and just take the shot, or you take anti-inflammatories. A lot of the tension comes from those muscles further up towards the knee, and if you address those muscles with the right therapy, some stretching, ice, some deep tissue work, you're going to see a lot better result because chronic plantar fasciitis really is painful. I mean, when you can't walk, the amount of that pain is really, it's very real. And if you don't address if you're addressing the head of the snake, okay, fine, you're going to have an issue with they'll be under control for the time being, but you're not really hitting the nail on the head. And that's why you have to go further up the food chain. Look at the tibia, the fibula, calcaneus, which is the heel bone, the talus sits above that. You can feel that in the front of your leg, towards the bottom where the ankle meets the feet. But also too is, I mean, you have the navicular and the cuboids, and there's another small bones called the cuneiforms. I don't find those out as much, meaning out of place. But I mean, you could have a bad sprain when you're younger, and then all of a sudden the sprain never gets healed. So you just go throughout your life, and a lot of times this is where someone would benefit from a insert to stabilize the foot. And you'd be surprised. I mean, my recommendation always is to start with a very inexpensive type of approach. There's a particular arch support called Superfeet, and these run anywhere from $30 to $45 at running stores, or you get them online. But those offer a good amount of support, and that's probably much more beneficial, in the short term by addressing that. I mean, really, by getting yourself a good orthotic, you can take tension off the tibialis anterior, the peroneals, the gastrocs, the soleus, all those other muscles. So what I want you to think about is, don't think that just the localized pain is the problem, and when you have no pain there, it's not. Do yourself a favor. Check out the rest of your leg and see what's going on. Find these tender spots. These tender spots will tell you that there's something else going on that's much more serious. So it really makes a big difference for you if you really want to truly heal the plantar fasciitis. And don't be surprised if a chiropractor adjusts your foot, because if the foot gets adjusted, that takes a lot of the tension off, because the balance is restored, the normal balance. When you have a good arch in your foot, the mechanical strength that it gives the body from that arch is, you cannot underestimate how important that is. And by getting extra support for the plantar surface, you would really have, you'll be doing yourself a tremendous favor. So keep it short and sweet. Inserts very good, but do your own homework, because if you go see a doctor, he's not checking your tibialis anterior, your gastroc, your peroneals, the talus, all those other areas. You're not going to get a true picture of what's going on. So the more thorough the examination is, where it includes, the bones of the feet, the bones of the lower leg, and also too is the muscles, you're hopefully going to have a better response, and see a much better result when you do get it treated. And again, people want the instantaneous relief. That's okay, but it doesn't always make a difference in the long run. And so if you got plantar fasciitis, I urge you, Superfeet, probably the least expensive way to go. I said somewhere between $30 and $40. You get them online. Pick your. They give you extra support. They put your feet into an anatomically efficient position. Now I get questions all the time about the proper footwear for feet. When you have plantar fasciitis, that's a tricky. It's tricky because you really got to go get your shoes fit. You know. Now some people prefer to wear sandals. Keen, Keen, makes a good sandal. Bionic sandals are another one. Um, Now, and Taos sandals. So you have those. Those are pretty good ones to start. When you go in, get them fitted though. Please go in and get them fitted, so that you have the opportunity to, let the person fit you properly for that particular foot. I mean, you really do. It would benefit you tremendously. You know. Now, people also ask how long. It sometimes it takes like 6 to 18 months to resolve without treatment. So that's a long time to be in pain. I mean, it's a real long time. There are a couple of good stretches, for plantar fasciitis, and one thing is, you have a stretch the calf. Stand against the wall, put one leg out, one leg closer, and really stretch the calf. You stretch the calf, you'd be stretching the gastroc and the soleus as well. Um, People will roll a foam roll, or you can take like a ball, like a lacrosse ball or baseball, and put pressure on that to disperse the tension in that localized area. I mean, you want to do that, you want to sit in a tall chair and you want to roll around for 2 minutes and do both feet because you may typically you only see plantar fasciitis on one side. It's rare that you're going to get it, but you know what you can do is also move the foot around. Like if you take a towel and you extend it to the bottom of the foot and get a good stretch, you're going to stretch not only the calf and the muscles in the plantar surface. There are tiny muscles in the bottom of your foot, but you're also going to have more. You get the hamstrings, so it's not a bad idea to just use that. And there's another one that people tend to do, which is pretty helpful. You put a towel on the floor and you try to roll the towel up with your toes. Sounds benign, but it's not bad. And another one is you try to pick up marbles. We actually with your toes. Um, you throw a couple marbles on the floor and you try to pick it up one at a time by curling your toes and then picking up and then moving the marble. You're working the smaller intrinsic muscles of the foot when you do that, and that can have a nice profound effect. I'm Dr. Brian McKay, Core Health in Darien. If you got plantar fasciitis, give us a call, 203-656-3636, 203-656-3636. Thanks for listening.